very much for being here. I'm Brooks Keel, the president of Augusta University, and we appreciate your spending a little time with us today as we bring you up to date on events that have occurred here and how we're prepared for and are dealing with it. First, as you have well heard from our governor and our president, social distancing is becoming an important strategy of flattening out the curve of the pandemic that we find ourselves in. As you know, Augusta University has suspended in-person instruction in almost all cases. Most of our students have already gone home. Some of our students that have clinical responsibilities are still here because of those clinical responsibilities, and we're providing essential food, shelter, and other services while they are here. Augusta University is still open for business, and in an effort to maintain business continuity during this time of enhanced social distancing, many of our staff who are able to perform their duties from home are teleworking. Others are using flexible scheduling and other creative ways to ensure business continuity while maintaining social distances. Our facilities, environmental services, and food service staff are following rigorous protocols to reduce the risk of infection while still providing important services to our campus. We are asking any essential personnel who are still on campus to help us carry out that business continuity to be mindful of the need for social distancing and good hand hygiene while they are here. Along those lines, Augusta University Health System and the professionals that are part of the state of Georgia's designated health sciences university and the state's only public academic medical center are well prepared and hard at work. As you may have heard earlier today, we are reporting that 2 employees of the Augusta University Health System have tested presumptive positive for COVID-19. In a few minutes, my colleague, Ms. Katrina Kiefer, will provide you with more information, and then Drs. Poole and Vasquez will follow up to provide you with the medical details associated with this. Emergency preparedness is not new for us. We plan for it every single day. We have an extensive plan for situations like the one we find ourselves in today, and we are effectively implementing it. We've been able to bring the full resources of our institution to bear on this crisis. Our talented and dedicated patient care professionals are prepared to meet this challenge, and they're carrying out their duties in exemplary fashion. Our researchers have been in the lab and have provided us with a limited testing capability that will allow us to more quickly manage cases that appear in our community. And you'll be hearing more about this exciting development. Our teams have developed a web and app-based platform to facilitate virtual screening of patients who may be experiencing symptoms related to COVID-19 that will allow our healthcare providers to care for our patients without taxing the valuable services of our emergency department and what it provides. You'll hear more about that. Our staff are working to provide logistical support for our healthcare system as it works to meet the emerging needs of our population. In short, and I've said this before and I'll say it many times, we have been over-prepared for such an event so that we do not have to overreact to a situation like we find ourselves in. We have some of the smartest and experienced professionals in America, and I'm proud to be associated with such an outstanding group. And to provide you with some more details, I'm going to turn things over to my colleague, Ms. Katrina Kiefer, Executive Vice President for Health Affairs and Chief Executive Officer of the AU Health System. Katrina?
Thank you, President Keel, and thank you for your leadership during this difficult and ever-evolving time. 2 individuals tested have resulted in presumptive positive for COVID-19. We are awaiting final confirmation from the CDC for those 2 tests. One of these individuals is an Augusta University employee, and the other is the spouse of an employee. They are not and have not been patients in our facility. They are currently isolated in their homes. They each became persons under investigation over the weekend. We expected to send the test out this morning and hope for a 24 to 72 hour turnaround in results. However, due to the forward planning of the pathologist and staff at the Georgia Esoteric and Molecular Laboratory, we call it the GEM Lab, at the Medical College of Georgia through the Augusta University Medical Associates, the FDA validation of our lab running the COVID-19 test was completed ahead of schedule late yesterday afternoon. The lab had limited reagents remaining, and there were 6 samples that were sent over last evening. 4 returned presumptive negative, and 2 returned as presumptive positive. Because we were able to leverage the capabilities of the Medical College of Georgia, we were able to preliminary diagnose those individuals much more quickly than if we had relied solely on other available testing options. Our leaders were immediately engaged to plan for today's public-facing activities. We also planned for activities such as notifying the affected individuals and identifying persons who may need to be quarantined. We also opened the Incident Command Center virtually to exercise social distancing ourselves, and have deployed communication related to limiting the number of entrances to the main hospital and medical office building for patients and all of our caregivers. We have been planning for months for what we knew would impact our community, but now has become an international, extensive pandemic. We are asking for your help to ensure that we can meet the needs of those in our community who most need our help and resources. I had a call earlier today with the CEOs of both University Hospital and Doctors Hospital. We agreed that these will likely be unprecedented times, but we have vowed to work together and keep each other informed to ensure the best care for the residents of all of those in the Augusta area. Please follow the CDC guidance as well as my plea to you. Do not come into the emergency room if you simply have symptoms of a respiratory illness without first calling to be screened. We have recently launched a COVID-19 hotline, and that number is 706-721-1852, as well as a remote screening application. The screening technology is free. It's available on our website and through both Apple and Android apps. We will be deploying additional guidance related to elective surgical procedures and scheduled physician office visits. We will also be keeping our website up to date with the latest information available. I want to personally thank the Augusta University Health System staff and leadership, and especially Dr. Poole, our Chief Medical Officer, for his leadership, and Dr. Vasquez for continuing to consult us on infectious disease matters. Dr. Keel and I will now trade seats with Dr. Poole and Dr. Vasquez as they come and give us some additional clinical information, and then we'll take questions.
Thank you for being here, and again, thank you for the role that the media is playing in conveying the right message to our patients and our community. At times like this, sometimes the response of people, there's always some people who don't seem to understand why we're conveying the message that we are, and I appreciate the media in getting out the correct message. It's important that in our current situation, we know that COVID-19 is here now. It is in our community. And it is important that everybody pay attention to the recommendations that the CDC, as well as state and local health officials, are pushing out to make the public aware and to protect the public. One of those important messages is the message of social distancing. Social distancing is when we limit contact with other people. The COVID-19 virus is spread within 3 to 6 feet of someone coughing or sneezing. And if you're not within that distance from people, then your risk of catching this virus is very low. Now, this virus has been described as like a terrible flu season. The big difference with this is that we do not yet have a vaccine for this virus. And because of that, we have to use other tools to help control it. Those tools are good infection control. Infection control is good cough and sneeze etiquette, washing your hands, social distancing as ways of preventing the spread of infection from one person to another. One of the characteristics of this disease that's important for people to understand is that people can have very mild symptoms, but what is a mild symptom for you could be dead, and they will typically be in quarantine for 14 days. Isolation is someone who has been diagnosed with the disease or is awaiting testing and is ill. So an ill person goes on isolation, and that is different than quarantine. the effect is the same. Those that are ill, those that are on quarantine or isolation, remain at home so that they do not risk spreading the disease to others. One of the unintended consequences of social distancing is that people are not donating blood. And because they are not donating blood, the routine use of blood within the healthcare system continues because the other healthcare needs continue. Because of that, there is currently a shortage of blood, and for those that do donate blood, please reach out to the Shepherd Community Blood Center to arrange for a time to do a donation so that we can restore the normal blood supply. COVID-19 does not cause a sudden surge and increase in blood supply, however, or blood need, but the social distancing appears to have caused a drop-off in the donations that are occurring. So please support the local community by exercising all of these infection control measures, as well as making sure that we donate blood to the Shepherd Community Blood Center. Dr. Vasquez is also here to answer any questions, as will I.
Dr. Quill, do you know the employee, were they in patient care?
The employee does have patient care duties, and exactly how extensive those duties are is unknown in terms of the level of contact. However, we are taking aggressive actions to make sure that we identify and take appropriate precautions with any patient contacts that the individual had.
Do we know if the patients had any travel experience or history? Do we know if they got it just being here in Augusta, or if they came from somewhere that is affected?
We're still gathering all of the facts. There was some association with travel with a close contact with the person that was affected, but no direct travel that I'm aware of for the employee.
So just to reiterate that fact, because we just found out about this, the important part to recovery of this is what's called contact tracing, right? So what we're going to do now is go and pretty much investigate these individuals, starting from when they were probably last week sometime, and every step they have taken, everywhere they've been, whether it's the grocery store, their mother's house, or whatever it is, and we're going to have to go back to see how many individuals have come in contact with him. That obviously will take a while. It's really like a private investigator, right, in infectious disease or epidemiology, if you will. Once we have those footsteps of that individual, then we're going to have to go back and then follow each of those footprints to whoever he was in contact with. Now, just because you said hello to me does not mean you are now all of a sudden, that's important to note, at risk. The thought is 3 feet, if it's easier to remember, is 3 feet for a couple of minutes, for 2 minutes. So that's really the contact time that you need. So unless that individual was in direct contact for a period of time, individuals do not have to worry about. But it's going to take some time for all of us to go back and find all of these contacts, right? Which can be, think about how many people you talk to or involved with on a daily basis, especially somebody at the medical center, where he had lunch with, who he had dinner with, where he had dinner with. All of that becomes very important. It may not be a big deal later on because the contact was minimal, but it's a lot of effort to go back and do this contact tracing, especially now since this is just the beginning, right? As I've been saying for quite a while, it's here and it has been here. There's no doubt it's been here, it's just that we didn't have enough tests. Now that we have testing, you can see how rapidly this happens. So would not be concerned that we're going to see several, quite a few individuals turning positive all over the metro area in the next couple of days. That's expected, that's normal. So ease off on the panic, ease off on the toilet paper. We really have to, those that need toilet paper are really a shortage. So at this point in time, so.
I do think it's important, though, that although Dr. Vasquez gave a lot of examples there, the overall risk remains low, especially if one is practicing social distancing and limiting contact. And the overall risk to the public remains low, but we should be aggressive in making sure that it remains low by employing all of these measures.
So the two people right now, it's an AU employee and then the spouse of another AU employee. Has that other AU employee been tested? If not, why not?
So when a person is asymptomatic, we do not test them. When they are asymptomatic, meaning they do not have symptoms of the disease, then they go on quarantine. So quarantine is you're exposed. So when someone is exposed and you know that you have a case, the ring around them goes into quarantine. If that person develops symptoms, then we will test that individual. But as long as they remain asymptomatic, we would not test them.
Why the 14? I mean, we continually hear the 14-day timetable. I think there may be a simple answer to that, but why is the 14-day timetable so essential for you all? And when it goes to the testing, like Sierra mentioned, if they're asymptomatic, is that 14-day timetable applicable because of that?
Yes, so the incubation period, and that is the time between the time you become exposed to the disease and you begin to develop symptoms of the disease, is 2 to 14 days. So that's why the 14-day quarantine period, because that is the outer end of when people develop symptoms. So we would expect them to develop symptoms within that 14-day period.
I do have another question to follow up to the last one I asked. So how exactly, is there a time frame? You said it's going to take a while to play private detective, but you can imagine that we do have people, including myself, who want to know if I touched their buggy at Target or if I walked into a restaurant that they walked into. Exactly, are we talking weeks, months, days?
I guarantee you've come in contact with somebody with coronavirus. If you're living alive and out there. So I guarantee you. So how long? No, we're actually, we have different tiers for contact. We want the most important contacts we go to first, and then we start building a lower tier, second and third tier. So it should not take more than a day or two for us to know all the people. It's not going to be a long, it's just that it takes a long time, right, to go through your life over the last week.
Yeah, I think what Dr. Vasquez is trying to say is it's a lot of work. We have a lot of people working on it very aggressively to make sure that we identify all potential contacts who would be at risk. And we will do that as quickly and as thoroughly as possible. And if that is necessary to notify people, we will notify them of the fact that they have been in contact with this person. But again, important messages though, even people that get the disease, the vast majority of them have minimal symptoms. So 80% or so have minimal symptoms, which also is why it's important to make sure that we reach out and that we look at the appropriate, or look at the people that have been in contact so that we can make sure that we catch those cases that may have minimal symptoms.
It's also important to recognize that the highest infectivity points are actually about 3 days before the individuals develop symptoms. So you are completely normal and you are infectious, right? You're contagious at that point in time. That appears to be the highest shedding, viral shedding. So even before you have a fever or a cough. So that's what makes it really hard, right, to figure out. And that's what makes it hard to do some of the contact tracing. So it becomes important, and hopefully within a short period of time, we'll be able to ramp up the testing. So we have an idea, right, of some of these individuals. If you go back to the Chinese data, 1 to 2% of individuals that tested positive for the test were completely asymptomatic. That doesn't sound like a lot, but in the 100 and some thousand, right, the several thousand they tested, that's a lot of people that were positive and were completely normal. Completely normal. No fever, no cough, nothing. They were going to work, doing their own thing. And they were positive, they were carriers.
Which is why it's important that right now we employ social distancing.
Right.
And we'd encourage particularly houses of worship to pay attention to that social distancing is a very effective tool to control the spread of this virus. Again, a lot like the same way you get the flu, and if you wash your hands and use good sneeze etiquette and good cough etiquette and practice social distancing, then your risk will be incredibly low. But that's also why those are so...
But knowing all of what Dr. Vasquez just said, people having the virus, being asymptomatic, can you help us understand the the testing guidelines? In theory, why can't you just test people who want to be tested?
Yeah, so you have to have an active infection in order to detect the virus. The virus has to be replicating so that there's something there to pick up on in the test. And if you test a bunch of people who you really shouldn't have tested, then the false positive rate goes up, meaning you could get some false positives mixed in with that. For both of those reasons, that's why you have to wait until someone develops symptoms in order for the test to be effective.
I think the other part to that is we don't have enough tests. I mean, that'll come in the future when we can do some asymptomatic epidemiologic studies, but we are hoarding our own tests actually to make sure that we're getting these. So we are not there yet.
So we are aggressively pursuing testing opportunities. We do have limited testing capability, and in this case, we were able to test these individuals much sooner. Because of the capabilities at the Medical College of Georgia at Augusta University, we were able to find this out perhaps 48 hours, 72 hours earlier than we would have found out otherwise, which is really important. Early detection allows us to then control this much more rapidly.
Do you know when you'll be able to get more reagents?
We are pursuing multiple opportunities and multiple venues to acquire those as rapidly as possible.
I think it's we're going to be able to ramp up testing,
I'm
not to
optimistic.
the hundreds or thousands, but we're definitely going to be able to ramp up the testing by the end of the week.
We are optimistic
Yeah.
that our testing capabilities by the end of the week will be greater.
Yeah. I mean, one of the conversations that I had when I took a conference call with the governor on Friday, the number one issue was we need testing kits. We need testing kits to figure out what to tell the public. Because without the testing, without the knowledge, it's very difficult for us to say what's going on in the community. So they promised that they were going to start sending them our way all over the state of Georgia, obviously. But that was one of the key issues that we had was we need these kits badly.
You doing drive-through, curbside kind of stuff?
We are exploring opportunities to do some expanded capability. Don't want to really get into the details of that just yet. We have a lot of planning and a lot of work underway to make sure that we are supporting the community in the best way possible.
So Dr. Cooley, you mentioned, I think as more cases are confirmed, there's growing concern, but the general outlook, it sounds like, is the same.
Yeah, so this is a new awareness of what is likely an existing problem, right? So as Dr. Vasquez alluded to, this has probably been here for a while, but as testing becomes more available, we just become aware of it. And it's important for people to understand that. This should not cause panic. This is expected. We expected that this would happen, and as we test for this more, we are going to find it more. And that is certainly what we have seen across the country and really across the world. Is as each country develops testing capability, suddenly the disease shows up in their country. It didn't just arrive, we just became aware of it. And that is certainly the same situation here.
How long are we going to be dealing with this?
So my prediction, if the China evidence, and certainly Dr. Vasquez can weigh in on this, if China has leveled off after about 3 months, so we're looking at somewhere around 3 to 6 months of this disease being in our community and creating challenges for the healthcare system. If we are able to get control of this through social distancing, that may actually stretch out, but the impact of it will be less.
If you're concerned about getting testing yourselves at a large university such as this, how are rural communities likely going to be able to handle this?
So the lab technology and expertise necessary to do this test is very extensive. It requires someone that is incredibly talented, well-trained, and with a lot of expertise in order to conduct this test. And we're fortunate that we have that here. Rural communities certainly are not going to have this. It really requires an academic medical center with research capability like we have in order to pull this off.
Yeah, to be clear, this test is a PCR assay, right? A polymerase chain reaction. And what it's doing is detecting little bits and pieces of RNA and amplifying it. So all we need is a little teeny bit of the RNA, and that amplifies it enough from small segments to then, so we don't have to grow it. This is not something we grow, not something we test.
And it's a closed
So-
system.
And it's a closed system. So we amplify a little teeny bit of RNA, which is what the virus is made from, and make it into a big one, and it's the signature that we're looking for now. So yeah, it's not a test, it's not a point of care testing where you can just, dab a little bit of blood on this and it'll turn positive. We're not there yet. Maybe in the future that will happen, but it definitely is technical, and you definitely need a molecular biology lab or a lab that's used to doing, PCR, fingerprinting, to be able to do this assay. Although most hospitals will have some kind of PCR assay. Not all hospitals do. So we're actually fortunate enough that we have the wherewithal to have all of this molecular testing and molecular know-how here, that we don't have to send it out, and instead of waiting 2, 3, 4 days, we can get it back theoretically within a couple of hours. So, and we hope to ramp up that testing once we have kits, so we can do it not only 7 days a week, but hopefully 24/7.
Because you have that capability, will you take any tests from anyone else?
We are looking at how
We
we,
want to continue to support the governor and his recommendations to ensure that we are serving as the state's public academic medical center. However, we also have a hospital lab, and those are the testing kits that are more fully being deployed throughout the country that we hear that are on allocation. So within the walls of the hospital, not the specialized molecular lab, we will also be working to get kits. More hospitals will have those kits and be able to do that testing locally. So there'll be a mixed bag. We do have the specialized lab in which we will be looking for reagents, but then we also have the testing kits, and many of even the rural hospitals will have labs that will be capable of running those tests. But again, if you're a small community like Albany, who's been overrun, they may have trouble getting kits, but I think that community has come together to share kits among each other. It's one of the other reasons that I reached out to the other local CEOs here to say we're in this together for our community, much like the example that we've seen in South Georgia.
Trina, you mentioned that the best thing for people to do who feel like they may have symptoms of COVID-19 is to stay out of the emergency room or to call before going in. You talked about the screening option, the remote screening option. Can you talk us through a little bit about how that works and what people can expect to see?
Absolutely. I'll start. Well, okay, Dr. Poole, I'll let you go take that.
so the remote screening option is that for patients that we would like to screen, they download an app, and that app is a telemedicine app. And when they download that app, they can essentially see the providers that are available. They create a profile, fill their information in, answer some questions about what their symptoms are, what their exposure risk was, what their medical conditions are. And then they're placed into a queue to see a provider. So we have physicians, nurse practitioners, and PAs who will be logging on also, and then taking those calls and doing a face-to-face video interview with the person to explore their symptoms, what their exposure risk is, what their other medical conditions are, and then determine if they need testing. If they need testing, the physician or advanced practice provider enters the order, and we have a system set up where it's a very convenient and also a very safe way for us to collect the specimen like other communities are doing, and we're looking to expand that.
Is there any indication that the warmer weather will have an effect on the spread of the virus?
So I'll take this, and certainly Dr. Vasquez can weigh in. We were looking at that early on because we didn't see a lot of activity in the southern hemisphere, and so we were hopeful that as the weather changed, it might have an impact on it. That does not appear to be the case. So it does not appear that the weather is going to have a particular impact on this at this point. However, who knows, a change in humidity, maybe it doesn't like the Georgia summer. We'll have to see.
Well, it's, for example, Miami, Florida, has a huge outbreak now. Dade and Broward County, it's 80, 85 degrees there. So the temperature doesn't, but I think what's important about the temperature is as it gets warmer, then individuals go out and do things like picnics and walks and runs and stuff like that. And that's actually social distancing, which we do. During the wintertime, we're all hoarded in. More so in the northern states and the southern states, but we're indoors, right? We go into restaurants, we maybe go to the movies, come back home, and there's everybody at home because it's too cold to go outside. But as it gets warmer, I think we'll be outside a bit more. We create our own social distance, which implies mitigation of what we're trying to do. And I think that's going to help. I don't think it's the temperature as much as us kind of dispersing ourselves in society instead of interacting and being on top of each other, you know, every Friday or Saturday night because it's too cold to go out or people don't want to go out. So I think that's the important part of that. So, and I think that's going to be an important part of, we have talked about it, but dropping this curve and blunting the curve, right, of outbreaks and plague is to disperse and go somewhere else. Good idea to go camping just about now. Fishing would be a great idea, you know, so really, I mean, it's not a bad idea. If you're with the kids and they're not doing anything and you're off of school, camping is great, going to the beach is great. Creating distance between anybody around you for the next couple of weeks is probably the best idea of all.
How important is that for?
I'm sorry, one additional comment about that too is we talked about social distancing, and I think it's great to mention that getting outside is social distancing, right? You don't have to basically stay locked up in your basement with, you know, plastic on the walls or something like that. You can go outside. The other thing that was mentioned earlier is it is important that you not just show up in the emergency department. It's incredibly important that if you think you might have symptoms of COVID-19 coronavirus disease, that you contact your healthcare provider or go through a screening process and determine if you have risk to arrange for testing rather than crowding emergency departments. Because that also creates potential exposures for others in the event, the unlikely event that you do have it.
How important is it for people with asthma to stay away?
We certainly know that asthma and any chronic lung disease is a risk factor for developing complications from COVID-19. So persons with asthma are at increased risk.
Can we go back to your two presumptive positives? Do you know when they start showing symptoms, and the fact that they're home, does that mean their condition is mild or they're not suffering?
Yeah, none of these patients is in our facility currently. Both of the patients that have tested positive, presumptively positive, are on isolation at home, and their known close contacts have already been told to quarantine. At this time, we have no patients in-house, and we are, again, trying to nail down the details of exactly when symptoms developed, and once we have that, we might be able to make that to you available to you later.
And we know with those cases you guys can't identify them because of HIPAA laws, but there is someone saying they are one of the presumptive positives. Can you guys at least tell us if the persons that have been connected to the presumptive positives, have they traveled abroad or within the state of Georgia?
Let me see if I can help you out this way. I am only aware of 2 presumptive positives in the community, and I have seen news reports about individuals.
Does anybody have any additional questions?
And these are presumptive positive until the CDC actually finalizes it. Do we know how long that will take?
The turnaround time has varied based on the demand from the CDC, on the state labs and CDC. I would expect that within 3 to 4 days at the maximum.
And again, you have not, again, keeping it with the understanding that we can identify these people, but do we know specifically where the employees work specifically within the AU system?
We're not ready to disclose that right now because we are going through the process of doing trace contacts and investigating program.
How likely is it that a presumptive positive could end up not being positive at all?
It is possible. We're confident in the test, And the validation process that you have to go through for a test like this is expensive. We are confident in the test. I fully expect that these presumptive positives will be positive.
It's a couple of percent. And the validation's like 98%. It's pretty good. It's a good test. So but it's still, nothing's 100%.
Thanks, everybody, for your time.
Thank you.